Welcome to the first session of the Embracing the Mission Learning track. My name is Randy Gleason, and I'll be moderating today's session. My connection with cystic fibrosis and the Cystic Fibrosis Foundation began 38 years ago. My parents were unknowing carriers of cystic fibrosis, and I was born with the genetic condition. Shortly after I was diagnosed, my parents and their friends, the Leesville JCs, began fundraising for finding a cure for CF. My very first fundraiser I attended, I was about 6 months old. It was a skating fundraiser. Throughout the last 38 years, we have worked hard along with other families and friends to help fight for a cure for cystic fibrosis. That has led to amazing drug developments that have improved the quality of life and extended the life for so many people, including me, living with cystic fibrosis. Today's session is titled Trailblazing Our Path to a Cure. This track will also feature 2 other sessions in the next couple of weeks about mental health in the CF world and the impact cystic fibrosis has beyond the lungs. During today's session, we will feature these speakers who will help us provide insight into how far we've come and how we plan to cross the finish lines to a cure. Please join me in welcoming our 3 guest speakers, Dr. Manwa Jain, Brian Donahoe, and Angela Lynn. Our speakers today will share their knowledge and experiences, and after they've all spoken, we will have time for some Q&A. Please use the Q&A feature to submit questions, not the chat box, so we can ensure we don't miss any. Feel free to chat with members from across the country in the chat box. Make sure you select everyone when you send a message. I'd like to welcome our first speaker, Brian Donahoe. Brian is a pharmacy operations supervisor at UPMC Shadyside Hospital in Pittsburgh, Pennsylvania. He is also currently pursuing his MBA. Brian has been involved with the CF Foundation for as long as he can remember, participating in the 65 Roses Baseball Club and Great Strides. He was recently elected to the Western PA Chapter Board of Directors, and in his free time, Brian loves to travel and has been to all 50 states. He also enjoys spending time with his wife and their 2 rescue chihuahuas. Thank you for being here, Brian.
Hi, thank you so much, Randy. Thanks for that introduction. So just kind of wanted to get today's session started by just kind of outlining, my path so far with cystic fibrosis. So as Randy mentioned, my name's Brian. I live here in Pittsburgh, Pennsylvania. I am also involved in the Tomorrow's Leaders in Western Pennsylvania here in the Pittsburgh chapter. So similar to Randy, 31 years ago, I found out that I had cystic fibrosis. I was born in September and was diagnosed 3 months later through a sweat chloride test. So my path thus far through life, at the beginning, it was not very difficult for me handling my CF. I had to do treatments, I had to take medication, but for most of my elementary and middle school career up until high school, I spent very little time in the hospital, only having to be hospitalized once. After that, I moved into college. As Randy stated, I got my PharmD. So I graduated with my PharmD in 2015. Unfortunately, while in college, I experienced a progression in my disease. My lungs function started to worsen. I spent a lot of time in the hospital, spent a lot of time infusing antibiotics at home. I have a chest port, which I use to take my antibiotics. So my lung function really just started to deteriorate. At this point, I was having trouble walking without oxygen. And the month before I graduated, I was evaluated for a lung transplant for the first time. This was a pretty scary moment for me because up until that time, I was pretty healthy. So whenever this happened, I really started to feel the impacts of CF. Fortunately, through my time here thus far, I've benefited greatly from a lot of the improvements that the CF Foundation has funded through antibiotic therapies, specific therapies targeted towards clearing mucus. I was really able to keep myself as healthy as I could. At that point, I was placed on the first modulator. You will hear about modulators today. So I was placed on the first modulator released through Vertex Pharmaceuticals, which is the company that has released the CF modulators thus far. That gave a slight improvement, but still I struggled with additionally needing to be evaluated for transplant again. I was placed on the second modulator release, again with a slight increase in lung improvement, but nothing to the extent that was able to take me off of being evaluated each year. At this point in time, to put it into perspective, my lungs were functioning at about the low 30% of normal. So from here, I just kept getting evaluated, kept having to deal with the trials and tribulations really of CF. Fortunately, though, I was very, very fortunate. Actually, it was about 2 days before my 29th birthday. I received a call from my CF Foundation, my CF clinic here in Pittsburgh, Pennsylvania, and they told me that I had become eligible through compassionate use for Trikafta, which was just being released from Vertex as their newest modulator. I started taking the drug a day later, and not even a week later, I could feel an impact. The funding of Trikafta was very much driven through the CF Foundation. Here in Pittsburgh, as Randy mentioned, I am on the chapter board of directors. I also, as I mentioned, participate in the Tomorrow's Leaders here in Pittsburgh, as well as Great Strides, which is a walk that is done for cystic fibrosis, and the 65 Roses Baseball Club. All of this was started through my parents in order to really drive towards getting those funds available, making funds available and having them here for research, for development of amazing new drugs. And the work that you all do in your Tomorrow's Leaders chapters really drives that as well. I was extremely fortunate to be able to really get this medication at a time that helped me to keep the lungs that I have and was born with. I feared at this point, when I was about 25 years old, that I would not make it to the age of 30 with the lungs that I had. I feared that transplant was really the only way. At that point in time, I had a very hard time looking forward and into the future. Since then, I decided to go back to school because 6 years in college wasn't enough. So we might as well go back again to get the MBA. I'm very fortunate that I'm able to do that. I got married. I traveled to my 50th state, as Randy mentioned. I was able to adopt two dogs, buy a house, and really start to plan more towards my future. I recently went to undergo kind of a test of if I would be able to have children. Really, all of this amazing research and all of the funds that drive this research have first kept me healthy throughout my younger years with the advancements made. And then as I got sicker, continued to follow along with me and really drive me to the point I am today, where I'm able to really plan more towards the future and accomplish all my goals. I'll just end with a quick thought. One thing my parents would always kind of drive home with me was, you might have cystic fibrosis, but that doesn't mean you have to be different from anybody else, from any other person that you may interact with. I might cough more, I might have harder time breathing, but really anything that I wanted to accomplish, they drove me to accomplish. And I think the CF Foundation and also my CF clinic has mirrored that. The doctors who worked with me all throughout have always pushed me, have always encouraged me, and just the encouraging and amazing work done from the foundation for research and development have kept me optimistic even in the hardest times. So I'd like to thank you all so much for your time today. And thank you all so much for really taking up CF as a cause, because if people didn't, there's a very likely potential that some of us would not be here today. And I think that's really my message is whatever I can do to help spread the word and help encourage and thank those people that have really made a difference for me. I'm here to do it. So once again, thank you. And Randy, I'll pass it back to you and let you share as well.
Brian, thank you so much for sharing. I think at a very early age, we kind of learn how to be optimistic and positive and hopeful, even in moments of great trials, almost probably as a survival mechanism, right? Like we had to do that to survive, with cystic fibrosis. And so I know how hard and challenging it is to really talk about the reality of life with cystic fibrosis and the therapies. So I just want to commend you for being vulnerable and allowing yourself to go there for a moment and really share a realistic life of what CF is and the hospital stays. And, so thank you so much, because that is probably one of the hardest things we do, because even though it's a part of our life, we work very hard to compartmentalize the negative and stay in hope and gratitude and positivity for all the amazing things. And so let's talk a little bit more. You mentioned about Trikafta. Let's talk about that a little bit more. I believe in our lifetime, the greatest medical breakthrough for us was cystic fibrosis, right? Do you remember the day that you took that first Trikafta dosage? Like, do you remember that day and what was on your mind?
I do. So kind of like I said, I was in the state at that point where, compassionate use was available for me, which means I actually received the drug slightly prior to its actual approval from the FDA. So I remember driving, as I mentioned, it was just slightly before my birthday. I got the call from my clinic. They said, "Hey, we just got these packages from Vertex. Please come down, pick yours up. We have your name on it. All you have to do is kind of like sign the form, like a consent form, since it hadn't been released yet. Please come down and pick this up." So obviously I drove straight there, knowing that this was something I had been working for and looking forward to for such a long time. I drove straight down, picked it up. They were like, "Wow, you're the first one here." I was like, "Well, you called me, so I came running." So I picked it up, and I can remember, just slightly before my birthday, getting probably the best birthday present definitely the best birthday present I've ever received thus far in my life of really renewed hope. I can remember just, not even maybe even a week into taking the medication, the feeling of the ability to breathe a little easier, the feeling of the ability to clear easier, to feel like my lungs could expand to a volume that, they hadn't expanded to in such a long time. At that point, I was really having struggles even getting up one flight of steps without having to stop and try to catch my breath. So it was just, a week later when I was able to go up the stairs, it was like, wow, I don't have to stop now. I can keep walking. It was just something, it was absolutely something that I will never forget. And a moment I will definitely cherish, and was very fortunate to have been able to, participate in, I guess.
Absolutely. I know for myself, I wasn't a candidate for the other modulators. So this was really my first experience with a drug that was quote unquote formulated for someone with my, genetic mutations. And I got my package in and I saved the pill because my mom and I were going to be together. And I wanted to take that first pill with her. We talk about, life with cystic fibrosis, but thankfully we're not in this alone. So whether, you have a spouse or a parent or parents or grandparents or a family member that really, from as long as you can remember, was there with you in the trenches and spent every vacation day and every, sick leave for their work, not for them, but in the hospital with you, and late nights cleaning nebulizers and all these things. So I wanted to save that first pill to take with her. And oh my gosh, by the end of the day, I'm like, I don't know what's happening in there, but some great things are happening. And, to be able now, I know most of us are on social media, and how you get those like Facebook memories, like, to flashback from times. And just recently, my aunt, who's also been a huge champion for fundraising my entire life, she shared a Facebook memory from about 7 years ago, and it was from a family birthday party. And I scrolled through the photos and I looked back and I saw myself in the background of a photo with a PICC line. And I just thought, if I could go back and tell that girl 7 years ago that your schedule isn't always going to be revolving around, your vacation schedule in a hospital, and PICC lines aren't going to be everything to you. You know what I mean? Like, it just hit me in my core, and it reminds me how grateful I am for the research and development of the Cystic Fibrosis Foundation their mission and their passion to help deliver therapies for people like you and I, and even for those that may not qualify. And they're going to talk a little bit more about that today. But it also reminds me of the people in our lives and in our community that they may not realize that they're one day at great strides, how much it impacts our life and how it impacts our hope for the future. Because, we're not in it alone, but it directly impacts our longevity of how we can be here, our quality of life. So it's just some very special things, right?
Definitely. I couldn't agree more. Just, as Randy said so eloquently, you look back at the memories of your life, and I look back at pictures of myself. In addition to the lung function that I've been able to gain, I've also been able to gain a slight amount of weight back. At one point, I, had lost a significant amount of weight to the point where I was down to, nearly needing a feeding tube. I look at how skinny I was in some of the pictures that I see. And I've been able to luckily gain back about 10 pounds now from the large amount that I've lost, but still looking back and just thinking about how things were going at that time, how I was spending so much time in the hospital. Like Randy said, I was spending Thanksgivings in the hospital. I was spending Christmases in the hospital. I was, my parents were in and out of the hospital room like a revolving door. My dad worked nights, so he was able to come in the day. He would sleep there sometimes. My mom would always be there. Whenever she wasn't working, it was just how much they sacrificed, and how much, also has been sacrificed by those who have really trailblazed, as is so-called the cure. The countless hours I can only imagine that have been spent in a laboratory, the countless minds that have gone into this, the countless dollars that have been invested into us, and Randy and myself and so many others with CF that have just been able to so wonderfully, benefit from such wonderful work and such wonderful people and such an amazing support system.
Absolutely. And we know with every, new therapy and new drug, there's always going to be, people react differently, and there may be, some side effects that go with that. And I'm so grateful that, that's something that's being looked at and moving forward, and new therapies that you guys are about to learn about. Never before Trikafta did I really have confidence that I could leave and travel with my husband for his job. I always kind of felt tethered to my CF center because of reoccurring bouts of hemoptysis and lung bleeds and things like that. And since Trikafta, it's really given me that hope and confidence that I can travel, that I can, that I can not be within, an hour of my CF center. And so it's such an incredible blessing. So we're so excited for you guys to learn even more that's coming from some of the brightest minds in cystic fibrosis. So thank you so much, Brian. And if you have any specific questions that you would like Brian and I to answer from a patient's perspective, remember to use the Q&A feature, and we will ask those questions at the end of the session. Next, I would like to welcome Angela Lynn. We are excited to be hearing from the CF Foundation on the modulators that are a part of the pipeline and what initiatives the foundation is working on to get to 100%. She is the Senior National Leadership Giving Director at the CF Foundation, and she also has a son with cystic fibrosis. Angela co-leads a major and legacy giving campaign entitled Milestones 3, Driven by a Dream. The goal of the campaign is to ensure that the Cystic Fibrosis Foundation has the resources it needs to make it to the finish line, a therapy, and ultimately a cure for all living with cystic fibrosis. So we know that not everyone has had an opportunity to experience the quality of life changes that Brian and I have had thanks to this highly effective modulator. Can you share about the foundation's path to a cure and surrounding initiatives to help all of those living with cystic fibrosis?
Absolutely, Randy. And so great to see you. Thanks to you and Brian for sharing your beautiful stories and your journey with cystic fibrosis. And I want to say thank you to each and every one of you on this call today for being part of Tomorrow's Leaders or being part of your chapter boards. For whatever reason you're joining today, you are making this progress happen. I was excited to learn that this is the 5th anniversary of the Tomorrow's Leaders program, and that in just 5 years, You have raised $23 million. That is an astounding number to me, boy, through your finest events and the other events that you've done. So congratulations and thank you. As you heard Brian and Randy talking about, it's the volunteer power that is fueling all this fantastic research and the progress in care. So I did want to share a little bit more about that. As Randy may have mentioned, I started with the foundation. I really started as a volunteer like you. I was on the chapter board of the Tennessee chapter here in Nashville, which is my hometown. I have two sons, Matt and Mike just graduated from college last week, and he has cystic fibrosis, and he's heading to graduate school in the fall. He's going to be going to Chicago towards where Dr. Jane is. So at any rate, very, very grateful. During that time when I was a volunteer on the chapter board, I shared great strides and worked on corporate sponsorships and was liaison to Care Center, all the different things that many of you were doing or are doing. But I'm so incredibly proud and excited to have so many folks like you guys getting involved right from the start in your careers or early on in your career. So thank you for that. So what I wanted to do is if you could show a few slides for us, Lauren, you might have the slides for. Yep, there we go. Just wanted to share 4 pieces of good news before we take a little bit of a deeper dive, and then Dr. Jane will really take the deep dive. But number one on great news is that now 57% of people in our patient registry are adults age 18 and over. That's an astounding number. I'll show you a chart in just a minute. That's a graphic of that. That has increased dramatically over the past 30 years. I believe when 30 years ago, it was only like 32% of people were age 18 and older. So that shows the incredible progress in our research and care model. Second great news bullet of the day is that last fall, we announced that for the first time, the median predicted survival age is now 50. And that's for children who were born between the ages of 2016 and 2020. That means that over half will live beyond 50. And that doesn't actually even take into account the true impact of modulators yet. So very, very outstanding, excellent number in progress. When my son, Mike, was diagnosed with cystic fibrosis in 2000, the year 2000, the life expectancy was just 30. So to go from 30 to 50 in that time span, we've been able to see that progress. It's just truly astounding. The third good news point of the day, the Trikafta baby boom. We may have heard about that already. Young women are healthier who have CF because of Trikafta and other modulators. And so they're more likely to be able to carry a child and become pregnant. And then also not only from the physical standpoint, but we're hearing that young women are feeling like they're healthier and going to be there for the child for the long haul. So from the mental health aspect, they're more willing to become a parent. So that's just another point of amazing news. And then the fourth point I wanted to share was that we have now spent over $100 million on our infection research initiative, which is a really important initiative. It's looking at how to better diagnose lung infections and also how to better treat those. We're also investing in new antibiotic and antimicrobial approaches. So we're very, very excited about that. We announced that $100 million goal in 2018, but we actually beat that by almost 2 years in spending over $100 million. So just next slide, please, Lauren. Thank you. This is back to that first point, just a quick visual. You can see that in the green, that's the percentage of individuals with cystic fibrosis who are children under 18, and that's remained relatively steady. But look how the numbers are increasing for people who are 18 and older. So this is all great news. People are living longer with cystic fibrosis. Next slide, please. This one also is just from a visual standpoint, it's very dramatic. This is that number that I was talking about, the number of pregnancies in women with cystic fibrosis. Look how dramatically that has climbed. Next slide, please. Okay, this slide, our drug development pipeline. This is a static version, but you can find a dynamic version on our website at cff.org. This is really very, very telling. We have almost 50 different potential therapies in our therapeutics pipeline. If you look at the numbers at the top, the number 4 in purple, the 3 in green, the 1 in blue, et cetera, those are therapies that are already approved for use for people with cystic fibrosis. If you look down below and you look at where it says preclinical on the left, and then phase 1, phase 2, phase 3, those are the potential therapies that are still in clinical trials. Or if it says preclinical, it means they're not even in clinical trials yet. This is the same model, the phase 1, 2, and 3, that the FDA uses no matter whether they're reviewing a drug to be approved for high cholesterol or for heart disease or for cystic fibrosis, but that we have nearly 50 different drugs in the pipeline, as we call it right now, is just amazing progress. I remember when I got involved in the year 2000, I don't even know if we actually had a pipeline like this, but I remember maybe 2003, 2004, we started putting one together, and or the national office started putting one together. I was still a volunteer, but it only had maybe 2, 3, 5, 7 different potential therapies. So the way that it's expanded is tremendous. And as you can see, with our therapeutics pipeline, we're covering a wide range of aspects of CF. Everything that's there in the purple, it's called generically restore CFTR function. That's basically addressing the basic defect. And Dr. Jane is going to talk quite a bit more about that in a few minutes. All the way down to the right, where it's nutrition, that's working on improving digestive enzymes. And that orange in the middle is infection research, which we just talked about just a minute ago. But looking at all the different aspects of cystic fibrosis and working to improve the health and quality of life for every person with the disease. Okay, next slide, please. All right, then what we want to do is, as what Randy and Brian were talking about, they're doing very, very well with Trikafta, but we want to keep on going because not everybody benefits from Trikafta. Either their mutation type doesn't benefit, and so they're not eligible for Trikafta, or some people are just not doing as well on Trikafta, and we want to keep on pushing forward until we have a very effective therapy for everyone with CF. And then ultimately, we want to have a cure for the disease. I think everybody involved with cystic fibrosis, that's our goal, is we want to cure this thing. So the CF Foundation launched the Path to a Cure in late 2019. The goal, again, is to deliver that cure for 100% of people with CF ultimately, and to find a therapy in the near term for 100%. That's a $500 million initiative that we announced, and that we plan to spend that between the late 2019 and 2025. That's a big number. That's over $100 million a year, or around $100 million a year. And that's basically what, in a good year, what we raise. And so everything that you are doing is making a tremendous impact on pushing these therapies forward and pushing us closer to a cure. So we're so grateful for what you're doing there. And also with the Path, one of the things that we are working on doing is attracting new talent to cystic fibrosis. We are looking at people who are in biotech and in universities who may not even be interested in cystic fibrosis yet, or they haven't been up to this point. But by offering them a chance to be able to apply for one of our awards, we want to get them into CF research and to bring new talent, particularly those folks that are really experienced and on the cutting edge of the genetic-based technologies. So before we move to the next slide, there was one more thing I wanted to mention that's important to our Path to a Cure, and that is the Cystic Fibrosis Foundation lab, which is outside of Boston in Lexington, Mass. There at our lab, it's not there to compete with biotechs or with universities, but it's there to push things forward faster, and where we see a wedge to keep pushing things forward. One of the things that we do is about 50% of the work that's done at our lab is working on identifying new small molecules or new potential compounds that could potentially become drugs someday for rare and nonsense mutations. We are also using the lab to collaborate with very innovative biotech companies to support our genetic-based research and to encourage them to get involved. And then one of the third focus of the lab is that we're working on publishing the results from something called serotyping, which is where we take the modulators that are already approved, like Kalydeco, Orkambi, Symdeko, and now Trikafta, and testing those different medications on these rare and nonsense mutations to see if any of them, if any of these mutations might respond to those medications. And we're publishing that work. We've already run the test on over 650 rare mutations so far. And many of those are people who are of African American or Latino descent, because we know, and Dr. Jane will talk about this a little bit more, that there's a disproportionate number of those folks who are not able to benefit from one of the modulators. So next slide, please. Just wanted to highlight four rather, potential drugs that are in the pipeline that will help us on our path to a cure. The first one is Vertex is actually working on a backup compound to Trikafta. Doesn't have a name yet, but it's got Vertex 121. They're just going to take out the Alexicaftor, put in Vertex 121, which is a corrector, and keep the Tezacaftor part, and then put in VX 561. And that's a once-a-day version of ivacaftor, which sometimes we call Kalydeco. That triple combination is in phase 3 testing right now. It might be about a year from now, maybe a little bit more, but when we'll have results. And we think that potentially that once-a-day compound could be better for people who are potentially experiencing liver issues and maybe some other side effects. And it perhaps may be more impactful for others who are taking Trikafta and maybe not seeing quite as many results. So if you think about it, if you're thinking about high cholesterol meds or heart disease drugs, there are 5, 6, 7 different types of medications that are addressing that particular problem. We think we need that with CF as well. The next one I wanted to highlight is AbbVie. It's a different pharmaceutical company, of course. They recently published some results from one triple combination that they were testing. Didn't quite reach the high bar that they had set, but they aren't deterred, and now they are testing a new triple combination. The AbbVie 2222 and the AbbVie 3067 are the first two. One's a potentiator, one's a corrector, and they're adding a third corrector there to try to test this new compound. And then the third compound that I want to talk about, or potential therapy, is Sionna Therapeutics. And it's very different than either of the two that we talked about so far, because it's addressing a different part of the CFTR gene, the NBD1 region, as you can see. And so there is some evidence that may actually be much more beneficial for some people as well. So we just announced last month a $5 million investment in Sionna Therapeutics. And then finally, Elox Pharmaceuticals is something we're very, very excited about. And at the end of March, we announced an almost $16 million additional investment with Elox. And that is, they are specifically working on nonsense mutations. And we awarded this additional $16 million so that Elox could expand clinical trials through our clinical trial or therapeutics development network to be able to test this Elox compound along with one of the currently approved modulators to see if there will be an even greater impact. So that's all I've got for today, Randy. Thank you so much. It's great to be with everybody.
Oh my goodness. Thank you so much, Angela. That was such incredible insight. I know for those that are living with CF watching this and their families and those in the community that are raising funds to really, get this train rolling down the road as we all strive for one mission, and that is to help every person living with CF. So thank you so much.
Absolutely. Thank you.
If you have any specific questions you would like Angela to answer, remember to use the Q&A feature, and we will ask the questions at the end of this session. Next, we will hear from Dr. Manwa Jain, who is the Professor of Medicine and Pediatrics at Northwestern University Feinberg School of Medicine. Dr. Jain's work as the director of the Adult Cystic Fibrosis Program for 24 years and the co-PI of the TDN Center at Northwestern has allowed him to chair the Genetic Therapy Working Group, looking at the clinical trial information regarding highly effective modulator therapy. Dr. Jain, can you share about the history of genetic therapies and what needs to happen to help us cross the finish line to a cure?
Absolutely. Thank you, Randy and Brian, for sharing your really inspiring stories. It really redoubles my efforts to keep working hard when I hear stories like yourselves. It's really gratifying. It also serves as a reminder that we really want to work to bring the kinds of treatment like Trikafta has been for you and Brian to everybody. So my goal today is really to provide you some information to empower everybody on this call to go out there and keep working hard to bring these therapies to everyone. To sort of set the stage a little bit, I thought it would be interesting to see where we are coming from. And what I've listed here, what I've shown here on this graph is a timeline of what's happened in CF over the last 80 years. So on the bottom, you can see the decades as they go from 1930 to 2020. And then in the yellow line, you see what the median expected survival has done over that period of time. And what's amazing is how it's continually improved over the span of 80 years. You can see that yellow line continuously going upward. And we had, a lot of hallmark events that have sort of contributed to this, including the creation of the CF registry, the creation of accredited centers, and lots of new medications you can see in the blue, including Dornase alpha, inhaled tobramycin. All these drugs were developed with help from fundraise that allowed us to do these studies to bring these drugs for people. We're in a new era now, this era of CFTR modulators. And on the very right, you can see the 4 modulators that have been approved: Kalydeco, Orkambi, Symdeko, and Trikafta. So all the improved survival that we've seen have been really before these drugs were implemented. So we expect to see continued improvement in survival for our people with CF. Next slide. So it took a lot of work. So I think one thing I want everyone to take away with is we didn't get here today easily or quickly. What I'm showing you here is timeline of how long it took ivacaftor, which is Kalydeco, Orkambi, Trikafta. The first studies of these drugs started probably about 14, 15 years ago, and Trikafta was approved in 2019. And we still need to get approval for our younger patients. Next slide. As you can see, these are ongoing trials for patients who are younger, under the age of 1 to 2 for Orkambi, and younger, 2 to 5 for Trikafta. So this takes a lot of work and time to get these drugs approved. So what is left to do in terms of new therapies? Well, before I get into that, I thought it'd be instructive to sort of go back to our high school biology class and think about what we learned back there. As everyone knows, DNA is our genetic code. It is this part of our cell that's abnormal in CF. There are mutations in the DNA. And the DNA mutations lead to an abnormal mRNA, which leads to abnormal protein. And this is a cycle of events that lead to the problems in CF. The protein is really the workhorse of the cell. And this is what our modulators target, is that these modulators help our abnormal protein work in a more normal fashion. This is where we see the clinical benefit. But certain mutations lead to to proteins that we don't understand how they are dysfunctional. And for these people, this modulators may not be an option. So what could work for them? Well, if we go back to this idea that if we correct either the mRNA, which is sort of the intermediary between the DNA and the protein, or actually correct the gene defect, then we could have treatment for anybody, because at that point, it wouldn't matter what your gene mutation is. If we can do a correction of your gene or your correction of your mRNA, this would lead to a normal protein and potentially be a treatment for anyone, so so-called genotype agnostic therapy. Next slide. So what are the future strategies to treat CF? On the very right, you see what we've had as traditional therapies like pulmozyme, hypertonic saline, inhaled antibiotics. Next to that, we see protein, targeting protein, which is a CFTR modulators. But the future and the path to a cure is in mRNA or gene delivery. In mRNA, we're targeting the mutant mRNA to correct that. In gene delivery, we're correcting the gene mutation by giving a normal gene to the cells. Next slide. So what is mRNA therapy? Well, the idea behind mRNA therapy is that we correct the mRNA, which is the intermediary. Now, one of the things that we've learned in CF over the last 10 years or so is that there's more complexity of the human airway than we thought. There are many different types of cells in the airway, not just one type of cell. These cells include ciliated cells, basal cells, secretory cells. And CFTR, the protein that's important in CF, is expressed in different cells at different levels. So one of the things we're trying to understand is where does the mRNA need to get to? Which type of cell does it need to be in to really rescue CFTR function? And so with that in mind, one of the technical hurdles that we have to overcome is to be able to get this mRNA into the right cell. The other issue that comes up is this mRNA doesn't necessarily last forever. So it's likely that if we develop an mRNA therapy, this therapy will need to be given periodically, whether it's every week, every month, we need to be re-administered. Now, one of the things that we also should keep in mind is that this idea of stem cells in the airway. Conceptually, if we could get the right gene into the right into the stem cell, this is a self-renewing population of cells, meaning it's there forever. So we correct the stem cells. That means we could have a one-time cure potentially. But the mRNA therapy doesn't actually get into stem cells the way it's designed right now. So that's why we need to continue to give treatment. Next slide. In terms of gene therapy, can you go back one? In terms of gene therapy, this is the idea that we give patients a drug, a therapy, which corrects the gene. And we give a normal copy of CFTR gene, and we restore CFTR protein function. It doesn't matter what the mutation you have is because we're giving you the correct copy. Again, in this kind of therapy, the CFTR gene would be functional for a period of time, but then would be lost and we would need to do redosing. The time frame of that is still unclear how often we need to do it. And again, this would not necessarily require delivery to the stem cells. The stem cells tend to be at the bottom part of the airway and really hard to get to when you nebulize the therapy. So it makes it technically challenging. Next slide. And finally, the holy grail is this idea of gene editing. This is a concept where we actually can go in and correct the endogenous gene mutation. We give a patient, a person with CF, certain medications, certain enzymes, which work to go to the mutation, correct it, and allow the cell to now function with normal CFTR. The ideal would be to be able to do this in this basal stem cell, because if you correct that stem cell, then you would have a self-renewing population of cells with normal CFTR, and that would allow a person to maybe be treated once, and that's all you would need. Now, this is the same idea of when we talk about CRISPR technology. This is what we're talking about. There are other ways to do this as well. This is just a table to show what these different therapies entail. So mRNA, gene delivery, and the gene editing. All people would be eligible for each of these therapies, regardless of your mutation. In terms of delivery mode, the lungs would be the first ones that would be targets for mRNA and gene delivery. For gene editing, potentially the whole body could be impacted. Potential challenges include that what cells these different therapies get into will be impacted by how often we'll need to give the therapy. And it's only the gene editing that could potentially be permanent. For mRNA and gene delivery, we would need to do repeat dosing over time. Next slide. So what are the similarities between what we have now, which are CFTR modulators, and the genetic therapies I've been talking about? Well, the similarities are shown on the left. They both target the underlying cause, which is important. They're both novel approaches, things that we've not had over the history of CF, and they all took a while to develop. CFTR modulators I talked about. These genetic therapies are also going to take similar amount of time to develop. The differences are on the right. The modulators target protein. The genetic therapies would try to replace mRNA or DNA. Modulators are taken by pill form, they're oral. The initial therapies for genetic approaches will be nebulized, perhaps IV down the road, but initially they'll be all nebulized. The modulators target the whole body. The way that genetic therapies are right now, we would initially target the lung and maybe look to target the whole body as time passes. Next slide. So who are patients that need these additional treatment options that I'm talking about? Well, clearly people who are ineligible, can you go back for a sec? Clearly people who are not eligible for modulators. And I'll talk about who that group is in a second. There are also people who start modulators but have side effects or adverse events such that they can no longer take modulators. And there are a small percentage of people on modulators who can tolerate it, but they have a relatively small clinical effect. And these people are also looking for additional treatment options. And potentially everyone, at the end of the day, as well as modulators work, they are still not a cure. So potentially any person with CF, regardless of whether they're eligible or not eligible, could benefit from these additional treatment options. Next slide. And so if you look at the registry and see who is eligible for, who are not eligible for these modulators, it is something to keep in mind. And if you look at people in the registry who, because of their gene mutation, no fault of their own, they just happen to have certain mutations, which group of people are not eligible based on what we understand about modulators. And as you can see, that people of color are disproportionately represented with respect to having mutations that are not addressed by Trikafta or any other modulators. So there definitely are people who have a higher need in terms of these genetic therapies. Next slide. So we're climbing a pyramid. It took us a while, as I said, to get here. When we approved Kalydeco, we made 10% of people eligible for a modulator. Then Orkambi got us up to 50%. Symdeko got us up to 60%. And finally, most recently, Trikafta, up to 90% of people with CF are eligible for this highly effective modulator. Where does that leave us? Well, we still have the remaining 10% or so before we can climb that pyramid. So this is the work that still remains to be done. And I urge you to continue your efforts to try to meet that needs for the remaining 10% of our people with CF. Next slide. With that, I'll stop, and I thank you for your attention and be happy to answer any questions. Thank you.
Thank you so much, Dr. Jane, for sharing. Be sure and submit a Q&A for a question for him to be answered in just a moment. Before we go to our Q&A, we can recall, I'm sure Brian as well, growing up, you know, your mindset was, I need to do everything I can to stay alive long enough because I have hope that therapy is coming. But for some in our CF population, it's much easier said than done. And there are so many patients who are struggling because they do not have access or, you know, like they just mentioned, aren't able to take these modulators. And so I want to introduce you to a patient and share her story.
My name is Liv, and I'm currently a first-year law student at DePaul University in Chicago. I want to do medical malpractice. I'm not sure if I want to do defense or prosecution, but I definitely want to go into something with health law. I feel like at a young age, I was always getting hospitalized. I had a surgery when I was a baby, and they just kept continuing from there. So it was always with me growing up, and it was always something that my friends were aware of. Living with cystic fibrosis is challenging. I'm normally used to being hospitalized 3 to 5 times a year from catching a virus or from having a pulmonary exacerbation. This makes it difficult with missing school, and it definitely takes an impact on my mental health when I'm not able to see my friends and family. My CF mutations don't benefit from any of the modulators currently on the market, but I got an opportunity to be in a clinical study where they would swab my nose and grow my nasal cells out and then test the current modulators on those. Unfortunately, they didn't work. I was obviously very upset. That was something that I was pretty confident in that I was gonna work. And my family was too. We had been looking forward to it. We were excited. So that opened a gateway to other clinical trials that I was able to get involved with. I've participated in one trial before for cystic fibrosis, and I'm currently in one for a new genetic therapy. I was initially hesitant to participate in a new clinical trial because it was a drug that wasn't FDA approved, and I was scared that it would come with long-term effects. But the research team was able to reassure me of everything and explain the technology in the drug before I consented to anything. So I'm very grateful for them and how they guided me along this process. The most important thing for me in participating in this trial was that it would not only benefit me, but other people with CF who don't qualify for the modulators. It definitely can be hard when I hear about people with CF that are on the current modulators, and when I hear that their lung function has improved and they haven't been hospitalized. But it also, at the same time, makes me optimistic about what could come for me. For anyone contributing to the research for genetic therapy and CF modulators, I just want to thank you with the utmost gratitude, because people like you are the reason that people like me with CF have hope, that CF will stand for a cure found.
Now we're going to open the floor for some questions and answers. Please use the Q&A feature, not the chat box, to submit your questions. We will give you all a moment to get those questions submitted, and we can dive right in. Okay, we're going to start with some questions that have already come through. So one moment. We're going to start with Angela. What is a patient registry, and are all patients with CF a part of it?
Okay, great question. Well, and Dr. Jane can piggyback on what I'm going to say as well. We started, the Cystic Fibrosis Foundation started our patient registry in the late 60s or early 70s. We were probably one of the first, if not the first, chronic health organizations to start a patient registry. It's a database of information about individuals who have cystic fibrosis. Someone with cystic fibrosis has to agree to have their biomedical data entered into that. I forgot exactly what the word is, but they make it anonymous. I'm sure Dr. Jane can tell us what the correct word is. I think it's, anyway, it makes it anonymous. But at any rate, when my son was a baby, we signed the paperwork so that they could start taking his data and entering that into the database. Once an individual turns 18, then that discussion happens again with the young adult as whether or not they want to participate. Does everybody participate? No, but it's a pretty high percentage of the 33,000 people that are in the US with CF. I'd say 29 or 30,000 are in the CF database. Dr. Jane, you may have a more updated number on that. But what's been really important about having that is that's helped guide care because, questions like, is there a smoker at home? What kind of medications have you been taking? They can track and have this metadata to be able to inform care decisions. And then also it informs how we design clinical trials. So it's been super helpful. And not only does the United States have one now, but organizations in Europe and in the UK about 5 to 10 years ago asked the CF Foundation to help them set up a CF registry.
Awesome. Thank you so much. Here's a question I believe that would be directed toward Dr. Jane. How could CF research also extend into helping people with other diseases?
Oh, that's a great question. CF is an incredible resource for not just our patients, but other patients too, because we understand, we don't understand everything, but we understand relatively a lot about CF. And the things that we learn and the medications that we develop for CF have some analogous principles to other diseases. And so there are examples such as Pulmozyme, which is used for non-CF patients. Inhaled antibiotics, which were developed for CF, are also used in non-CF patients. So whatever knowledge we've gained that, from doing these clinical trials in CF, we learn so much that we can use those principles to apply to other diseases, people with other problems, and help them as well. So it has had a broad impact on care, just not in CF, but other people as well.
That's great. Thank you so much for sharing that. Brian, what was the most unexpected change in your life post-Trikafta?
So I would say for me, when I would wake up in the morning, I would tend to cough a lot. I was able to produce a lot of sputum, a lot of mucus. It was usually very thick and, not a very pleasant looking color. So whenever I started taking Trikafta, within the first couple of days, the sputum started to go away. Whenever I used to go to clinic and offer up a sputum sample, it used to be like probably one of the easiest things to do. You just cough and it came out, and it was easily, sent down to a lab to analyze for anything that might have been in it. Now I struggle. I struggle mightily to produce on command like I used to. I have a lot of trouble going to clinic and feel almost embarrassed to the point where I can't produce what I used to. So it's a lot harder to culture anything out of it because just the production has gone so much down from what it used to be. So that was really something. I mean, I had read up on all of the, information, all the trials beforehand. Being a pharmacist, I just, kind of like to do that. My pharmacy background comes from really the fact that I had CF and had to take medicine for so long drove me even into the career I am now. But so I was expecting a lot of great things. The one thing that I wasn't expecting was not being able to clear as much mucus anymore. That was really something that was surprising to me. I thought, oh, it's all still going to be there and coming out. It's just going to come out even more. But now it just doesn't really come out because
I felt like a child at clinic. They're having to do a throat culture because I couldn't produce sputum. I'm like, I forgot how to. It won't work. It won't do it.
I feel so bad.
So I feel you there. That's exciting. And then also not coughing all night. Like we just took for granted, we just coughed all night long, and now you actually get a little rest. Okay, thank you so much, Brian. Randy, you've been involved with the CF Foundation for many years. What has been the most rewarding thing you have seen or been a part of? That's hard to pinpoint, but I can tell you that it was the most exciting day when I could let all of the friends and family that have fundraised for decades see that the CF Foundation delivered. There's so many things we give our money to, that we give charitably to things, and we really don't know from there, if something good came out of it. And it was so exciting. The most rewarding thing was to be able to, let people know, oh my gosh, this is the drug, like the latest development, and it's working and it's doing amazing things. And I feel like, we prayed and we hoped for this for so long. And I know it's the start. I know it's the start for so much more to come for everyone with CF. And I think one of the hardest things that people like Brian and myself deal with is that heartbreaking, spirit crushing when we really think about those who do not have these results. But we know that it's coming. We know that it's coming, and we have hope because of all that the CF Foundation does. Okay, let's final question here. We have a few more, and we're trying to filter through them and stay on time. Angela, can you talk a bit more about funding and how the CF Foundation is able to continue to advance drug and research development?
Great question. Well, funding is from you guys, right? In large part, our fundraising dollars certainly cover a big part of what we do with the research and care. And that's everything from walking the cycle to the finest events that you all do with as tomorrow's leaders. People have left us in their legacy plans or a planned gift after they pass. There's major gifts, there's everything. So that all goes together no matter what your channel is, your giving channel, what your passion is, that comes together. We also have a nest egg that we use the investment income off of, and also dip into the principal to be able to fund the research and the care as well. So all this together rolls up to be able to do what we do. We've really accelerated the pace of what we've done over the past 5 to 7 years. So thank you.
Absolutely. Well, thank you to our speakers, and thank you to all of our attendees for taking the time to join today's call. We hope that you feel empowered now to make the ask and engage your network. We thank you for your work in supporting the mission of the Cystic Fibrosis Foundation and changing the lives of those living with this disease. This session concludes our first Tomorrow Leaders Learning session in CF 201 Track 2, Embracing the Mission.